Hi everyone, I'm Dr. Adarsh Hanapareddy. I'm an orthopedic and joint replacement surgeon at Sunshine Hospitals. I specialize in total knee, partial knee and total hip replacement surgeries. Today I'll be speaking to you about partial knee replacements. So before we talk about the knee replacement surgery, we need to understand about the knee joint and about arthritis of the knee joint. So for that I have a model here. I wanted to show you what a knee joint looks like inside. So this is the upper bone known as the femur. This is the lower bone known as the tibia. And in between, if you see this bluish area, this is a cartilage. Okay, this is basically like a shock absorber of the knee joint. So this is what a normal knee looks like. What happens with age is this starts to wear away. It's just like a car tire. When you drive a car a lot, the tire starts to wear out. The same thing happens with the cartilage. It starts to wear out and it looks like this. Okay, so this is what happens when the wear out of the cartilage happens completely. Now, if you look at inside the knee joint, if you look at an X-ray, this is what an X-ray looks like. This is the femur bone and the tibia bone. There is a gap in between the two bones. But what happens when the cartilage starts to wear out, the gap starts reducing and the bones start coming closer together and start rubbing and cause pain. This is basically arthritis. So knee arthritis consists of 4 stages. As I said, the first stage, the gap reduces a little bit, the second stage a little bit more, and the fourth stage is when there's no gap at all and the bones are literally rubbing against each other. It's in this stage that a knee replacement surgery is required. So there are different types of surgeries for this. One is a total knee replacement, which is a very commonly done operation now. Hundreds and thousands of patients have benefited from this surgery. So what we do there is we cut off the worn out bone on the femur and on the tibia, and we replace it with a metal like this. Metal on the top and metal at the bottom, and a plastic comes in between. So this regains our joint space and the movement becomes free and painless again. But what I'll be talking about today is a new kind of a procedure known as a partial knee replacement, which has many advantages over a total knee replacement. Although a total knee replacement is a very good surgery, the partial knee replacement has some advantages over that. So what is a partial knee replacement? It is basically replacing the worn out joint, but you're not replacing the whole joint like we do in a total knee replacement. So this is the model of a total knee. And if you see this model over here, this one over here, this is a partial knee replacement. If you can see the difference between this one and this one, or even this one and this one, this joint is being replaced completely, but here only the half of the joint has been replaced. It's a partial knee replacement. So there are many advantages of a partial knee replacement. So the question is, what are the advantages? So I'll just list around the top 4 advantages of a partial knee replacement over a total knee replacement. If you can, obviously, the partial knee replacement is cutting less of the bone than a total knee replacement. You're not touching the unaffected bone. So definitely there's a lesser incision, smaller incision. The amount of pain after a surgery for a total knee and a partial knee, the partial knee replacement has much less pain after a surgery. The recovery time is much faster with a partial knee replacement. Although recovery for a total knee replacement is good, within a month the patient is walking mostly pain-free. A partial knee replacement patient can recover almost in 10 days without even a walker support. The most important advantage of a partial knee replacement over a total knee replacement is the range of movement. A patient who has gotten total knee replacement can usually bend the knee up to 90 or even up to 100 degrees. But a patient with a partial knee replacement can bend the knee even up to 120 to 130 degrees. So you may have understood by now that a partial knee replacement has many advantages over total knee replacement surgery. So you may ask, can everybody get a partial knee replacement done? Not really. So as I said before, when the joint is completely worn out, a total knee replacement is the best surgery for you. But there are some instances and some patients who have wearing out of the joint only on the inner side. If you see this model over here, this part of the joint is completely normal still. The cartilage is still fully intact. Only the inner side of the joint has been worn out. This is known as medial osteoarthritis. So only the medial part of the joint has been worn out. So it's this kind of patient who can get a partial knee replacement done. When the outer side of the cartilage is still intact, you don't touch it at all and you replace only the worn out part of the joint. So the next question is, when do you consider getting a knee replacement surgery done, whether it's a partial knee or a total knee replacement? So the first sign of arthritis in the joint is pain in the knee joint, obviously, especially when you're walking, when you're sitting down, when you're squatting, when you're getting up, the pain increases. When you're climbing stairs, the pain increases. Then you should know that there is some wear and tear happening in the knee joint. So as I said, there are 4 stages of arthritis. The first 2 to 3 stages don't require a surgery. Do visit your surgeon, get an X-ray done, or visit your doctor, get an X-ray done, and he will tell you some physiotherapy exercises and medicines to reduce the pain. But once you have come to a stage 4 arthritis, whether it's a complete joint arthritis or whether it's only a medial joint arthritis, that is the stage where you may require a surgery. You will find that activities of daily living, like even walking to the bathroom, are very painful. and you find that you're not able to do your regular activities like cooking or walking around in the house, that's when you have to consider seeing a surgeon and getting a plan done for a surgery, whether it's a partial knee or a total knee replacement.